Welcome to today's video where we will examine 7 warning signs that can appear 1 month before a stroke. You have surely heard of stroke, haven't you? But have you ever wondered if your body gives any warning signs before a stroke? If you experience any of the symptoms I will tell you about in this video, you must seek medical help immediately because these could be signs that you are about to have a stroke. These 7 warning signs can appear up to 1 month before a stroke. Delayed diagnosis increases the risk of significant brain damage. Stroke risk is independent of age, gender, or health status. Regardless of your profile as a young or healthy individual, cardiovascular diseases are increasing globally, including in the younger population. This is undoubtedly the leading cause of death, as more than 795,000 people have a stroke each year, and approximately 159,000 Americans die from stroke annually. Today, we will examine 7 warning signs that can appear 1 month before a stroke. You will learn how to prevent this disease and how to avoid becoming part of these shocking statistics. Many signs appearing a month before a stroke are subtle and frequently overlooked, leading to misinterpretation. Recognizing these signs is crucial regardless of your age, health status, or presence of other health conditions. Strokes can affect anyone, therefore, remain vigilant. Sharing this video with your family and friends could be instrumental in saving lives. Additionally, I will clarify the distinctions between ischemic and hemorrhagic strokes, enhancing your understanding of these conditions. I will also cover what a brain aneurysm is, including its warning signs. Importantly, you will learn about transient ischemic attacks, which can precede a stroke. Recognizing their signs and symptoms could be life-saving for you or a loved one. Remember, if a first-degree relative has experienced a brain aneurysm, it is crucial to consult a qualified neurologist for screening even in the absence of symptoms. This proactive step is essential for early detection of potential brain conditions. Now let us dive in and discover the 7 signs or symptoms that can occur a month before a stroke. Symptom number 1. Persistently elevated blood pressure. Discussing persistently high blood pressure in the context of stroke risk highlights the dangers of chronic hypertension. If it is not well controlled, it can significantly increase the risk of a stroke. Blood pressure measures the force exerted by blood against our artery walls. When this pressure escalates, known as hypertension, it poses significant health risks. This elevated pressure can cause damage to blood vessels, leading to narrowing, weakening, or even rupture over time. All of these significantly contribute to stroke risk. If a blood vessel in the brain ruptures due to high blood pressure, bleeding can occur, resulting in a hemorrhagic stroke. Similarly, if high blood pressure damages arteries that supply blood to the brain, it can reduce blood flow or cause an obstruction, resulting in an ischemic stroke. Therefore, managing hypertension is vital. Adopting a healthier lifestyle and adhering to prescribed medication regimens to control blood pressure are essential steps. These measures are crucial to reduce the risk of stroke and other cardiovascular diseases. Symptom number 2, excessive fatigue. Excessive fatigue or extreme tiredness can be a symptom or warning sign before a stroke. It is important to remember that fatigue can also have other causes. If you are experiencing intense, persistent tiredness that may be atypical for you and is not related to physical exertion or lack of sleep, it could be an alarm. This excessive tiredness may be related to changes in blood flow to the brain. It can be due to narrowing of an artery due to atherosclerosis or a possible clot there, which interferes with the supply of oxygen. So if you are feeling an abnormal level of tiredness, also seek medical evaluation. Sometimes extreme fatigue can precede a transient ischemic attack or TIA, signaling a temporary disruption in the brain's blood supply. A TIA acts as a critical warning and a temporary condition that may indicate an impending stroke. In a TIA, symptoms are temporary and typically last from a few minutes up to several hours without causing permanent brain damage. Patients experience similar symptoms to those of a stroke, but these symptoms fully disappear within less than 24 hours. Typically, this occurs when an artery in the brain is temporarily blocked. Within 24 hours, the body successfully dissolves the brain clot, leading to the disappearance of symptoms. This rapid resolution serves as a crucial warning that a stroke may be on the horizon. Pay close attention to this. If you notice any transient signs or symptoms, it is imperative to seek medical attention without delay. Symptom number 3, vision problems. If you experience any sudden changes in vision, it can be a warning sign. Blurry vision, double vision, eye problems, or difficulty focusing can signal circulatory damage in the brain and serve as warning signs of a stroke. While there are various causes for vision problems, it is crucial not to overlook these symptoms. Vision loss may result from the blockage of an artery supplying blood to the eye, often indicating an ischemic stroke, the most common stroke type. So it is essential to take such changes seriously and seek medical evaluation promptly. Symptom number 4, sudden and severe headache. A sudden and severe headache can precede a stroke. It is important to note that not all headaches are related to a stroke, and not all strokes are preceded by a headache. In ischemic stroke, the headache occurs due to the obstruction of blood flow in the brain. These pains, when they occur, are described as severe and sudden. In hemorrhagic stroke, characterized by bleeding within the brain, the intense headaches result from increased intracranial pressure due to the bleeding. Elevating brain pressure. Witnesses of stroke incidents often report seeing the affected person clutching their head, displaying an expression of intense pain, followed by a loss of consciousness. This reaction is particularly common in hemorrhagic strokes, where the headache experienced is frequently described as the most severe in the person's life. Sometimes a severe headache could also indicate an imminent risk of an aneurysm rupture within the brain. Symptom number 5, numbness or weakness in body extremities. Numbness or weakness in the extremities, especially on one side of the body, can be a warning sign before a stroke. Such symptoms may manifest during a TIA, a temporary condition of reduced blood flow to a part of the brain. This sudden numbness or weakness typically affects a single body part, like an arm, leg, or one side of the face, leading to decreased sensitivity. Although these symptoms often last for just a few minutes to a few hours, they should never be overlooked, regardless of whether they signal a stroke or another neurological issue. Immediate medical investigation is essential. Symptom number 6, speech problems. A person about to have a stroke may suddenly have difficulty speaking. This can manifest as slurred speech, challenges in articulating words, or in forming complete sentences. Such difficulties are categorized under aphasia, defined as the impairment in understanding, formulating, and expressing speech. Symptom number 7, neurological problems. Individuals on the brink of a stroke, whether it be hemorrhagic or ischemic, may exhibit a variety of neurological symptoms. These can include memory issues, loss of balance, as well as nausea and vomiting. These symptoms may manifest a few days or even weeks before a cerebral event. It is crucial to remember, however, that various other conditions can present similar symptoms, complicating the diagnosis process. Conditions such as migraines, seizures, hypoglycemia, brain tumors, anxiety attacks, and infections in the central nervous system, for example, can all elicit these symptoms. it is imperative to consult a qualified doctor for a comprehensive evaluation to accurately determine the cause of these symptoms. What is the difference between ischemic stroke and hemorrhagic stroke? The difference between an ischemic stroke and a hemorrhagic stroke lies in their causes and effects on the brain. An ischemic stroke occurs when there is a blockage in the blood supply to a part of the brain. This can be caused by a blood clot that forms somewhere else in the body and travels to the brain, or by plaque that forms in the arteries of the brain itself. A prevalent example of a condition that can lead to such clot formation is atrial fibrillation. This type of heart arrhythmia disrupts the normal, smooth flow of blood through the heart. Combined with other factors, it can significantly increase the risk of clot formation within the heart chambers, which may then travel to the brain, causing an ischemic stroke. These thrombi coming from the heart most of the time then travel to the brain, leading to an ischemic stroke. Thus, atrial fibrillation is a type of cardiac arrhythmia related to ischemic stroke. In the case of obstruction by plaque, there is an accumulation of fat and formation of atherosclerotic plaque, which blocks the flow of blood through the brain. This can occur in patients with elevated cholesterol, high blood pressure, diabetes, and smokers. When blood does not reach a part of the brain, the cells in that area can begin to lack oxygen and nutrients, which can then lead to brain injury. This type of stroke is the most common and represents 85% of all cases. In a hemorrhagic stroke, there is a leakage of blood into the brain. This occurs when a blood vessel in the brain bursts and the blood spreads to areas where it should not be. The leakage of blood can cause pressure and damage the surrounding brain cells. This can result in various complications. In summary, in an ischemic stroke, there is a blockage in blood flow, while in a hemorrhagic stroke, there is a leakage of blood into the brain. Both types of stroke are serious and require immediate medical attention to minimize future damage. A common cause of a hemorrhagic stroke, the type that involves bleeding, is a cerebral aneurysm. And it is possible to know if you have a cerebral aneurysm before it ruptures. Cerebral aneurysms are abnormal dilations in a brain artery looking like a bubble in the arteries. There is a risk they may weaken and rupture. That is where the danger lies. Often, a cerebral aneurysm does not have any symptoms until a rupture occurs. The individual never felt anything, and suddenly a cerebral artery ruptures, and they have a hemorrhagic stroke. This can happen in many cases. Despite this, there are some signs and symptoms that can also indicate the presence of a cerebral aneurysm. It is important to know that if you suspect a cerebral aneurysm, you must seek medical attention as soon as possible because the rupture of an aneurysm is a medical emergency. But the good news is that not all aneurysms rupture, and many people live with them without any problem. Many people out there have a cerebral aneurysm and do not even know it. But it is important for you to know that it exists. How to detect a brain aneurysm? When a doctor suspects a cerebral aneurysm, they may order specific tests such as a CT angiography, MR angiography, or cerebral arteriography to check if the aneurysms are at risk of rupturing and if they need to be treated. For those who are wondering whether it is possible to diagnose an aneurysm, there indeed is such a possibility. Since most of them are asymptomatic, an aneurysm is investigated when there is a family history. Therefore, it is important for your first-degree relatives to undergo investigation. How to prevent a stroke? Control your blood pressure. If you have diabetes, control your blood glucose levels. Maintain your ideal weight. Exercise regularly, at least 150 minutes per week. Eat fresh and healthy foods. Avoid processed foods. Avoid consuming sugar, excess saturated fats, and excessive alcohol. If you smoke, consider changing your habits. Sleep well, control your cholesterol. Keep your checkups up to date with your cardiologist. This will indeed prevent a possible stroke in the future. I hope you like this video. If so, please like and share with your loved ones. If you are new to our channel, do not forget to subscribe and turn on the notification bell to support our growth and not miss our next video. We are curious. Did you know about these silent warning signs before a stroke 1 month in advance? Share with us in the comments below. Thank you for watching and see you in our next video. Take care.